Pharmacy measure antibiotic avoidance, bronchitis. The populations that are included for this pharmacy measure would be patients 3 months of age and older, and the numerator per HEDIS would be patients 3 months of age and older with a diagnosis of acute bronchitis or bronchiolitis that did not result in an antibiotic dispensing event on or 3 days after the diagnosis. The exclusion criteria for this pharmacy measure are as followed. First, comorbidities present at or within the 12 months prior to the encounter, including HIV, malignant neoplasms, emphysema, COPD, cystic fibrosis, other malignant neoplasms of the skin, and disorders of the immune system. Next one would be diagnosis of an infection for which an antibiotic prescription is appropriate, such as bacterial pharyngitis, on or within 3 days after the encounter. Next would be an antibiotic medication dispensed within the 30 days prior to the bronchitis, bronchiolitis encounter. And lastly, encounters that result in an inpatient stay. This slide addresses documentation requirements for this particular pharmacy measure. This measure is not met if a prescription for an antibiotic is dispensed within 3 days of a diagnosis of acute bronchitis, bronchiolitis, barring any exclusions, and this data is captured via pharmacy claims. One common insufficiency in this pharmacy measure is failing to document comorbidities and/or competing diagnoses. In this slide, you can see the different codes that can be used to code for acute bronchitis, and each of these different codes are associated with the cause of that particular acute bronchitis. For example, rhinovirus, echovirus, and the remainder that you see on this slide. At Arizona Care Network, we highly recommend you review ACN Provider Portal for patients identified as non-compliant for this measure and provide education to clinicians as appropriate. Educate patients and caregivers on appropriate antibiotic use and the risks of overuse, for example, resistance to future bacterial strains, and instead recommend at-home treatments to help alleviate symptoms. Our care coordination team can provide patients with individualized support. To refer a patient, please contact us at 602-406-7226 or 855-218-3451, and the following is our care coordination team email address. Some tips for increasing your performance is we highly recommend that you work with your CPC to educate your team, build workflows to chart prep and identify open gaps before a patient comes in for an appointment, and familiarize yourself with Arizona Care Network resources available to you. For example, CPC education and support, quality measure tip sheets available on our website, Arizona Care Network Provider Portal, as well as the Arizona Care Network Care Coordination Team that is available to you and your patients. Please visit the Arizona Care Network website for updated 2024 tip sheets, and the following picture is the picture of the tip sheet that's associated with this particular pharmacy measure, antibiotic avoidance for bronchitis.